I'll call this special regional council meeting to order. Developing meaningful relations with our Indigenous neighbors is a priority of the Northern Rockies Regional Municipality. As such, we are collaborating with First Nations governments and Indigenous organizations to develop a respectful and meaningful territorial acknowledgement. This work also presents an opportunity to learn more about the culture and history of the Indigenous people of our region. Please be advised that today's meeting is being recorded. Can I get a motion, please, to adopt the agenda? Moved by Councillor Roper, seconded by Councillor Penny. All those in favor? Carried. Well, I want to welcome our delegation, Angela DeSmit, Sandra Rossi, and Annette Wager. Welcome. In the council chambers here today, we have Ms. Scrimshaw running our computers, Jaylene McIver, Mr. Scott Berry, our CAO. We have Mr. Ryerchuk, our treasurer, and Ms. Hanson, our deputy corporate manager. And we have councillors Gerwing, Councillor Andrews, Councillor Roper, Councillor Penny, and myself, Mayor Gary Foster. So welcome. Recruitment update. Mr. Smith, did you want to start?
Yes, thank you, Mayor Foster, and thank you for inviting us to, we weren't sure if you wanted just to have a conversation or if you'd like for us to make a presentation. We did develop a presentation that was modeled off of the presentation that we gave back in February to the Northern Rockies Community Health Planning Steering Committee, and just have updated it. So what are the wishes of Mayor and Council?
I think that would be fine, just to give us that presentation, and then maybe we can engage in a conversation afterwards.
Okay, so I'll, Sandra, do you want me to share my screen and then you can start speaking to it?
Oh, you're muted, Ms. Rossi.
That'd be great, Angela. And I'll just get you, Angela, speak for what there's some slides for yourself and Annette. I know that you'll have the details as well. So thank you so much for having us this evening. So yeah, this presentation, we're open to questions either throughout the presentation or at the end, but just wanted to share with you just some of the work that we're currently doing at Northern Health. And as Angela said, we had already presented a similar slide deck, but wanted you to have that too. The first piece of information that we have, and I'll just get Angela to switch to slide 2, is talking about our recruitment philosophies. And our recruitment philosophies were vetted through our board a few years ago. And that's what we really focus on when we're developing what we're doing and prioritizing Northern Health's framework. So one of them is foster an in the North, for the North recruitment and retention philosophy, foster culture, respect, and cultural safety for Indigenous peoples. And you'll see that there's some key work that we're doing in that area as well. And cultivating an organizational approach to recruitment, emphasizing recruitment, everyone has a role. And so although we have a recruitment department that focuses on our external recruitment, we also have internal partners for all our internal churn. And we know that every single person working for Northern Health has a role, as well as those in our communities in bringing folks into the organization and communities. We're also working at enhancing stakeholder engagement through purposeful partnerships and relationships that support our recruitment strategy. And then also identify and determine metrics to evaluate to help inform current and future recruitment in strategies and initiatives. And I'll speak to some of those that are new as well with the Ministry of Health. So we've got a few that committees that I'm sitting on that I'll be able to update you on that are relatively new. Moving from that, the next slide that we have talks about priority professions, and why this is important is when we're looking at the focus of our healthcare recruitment is the province has what is called priority professions. So it's not something that Northern Health decides on. Ministry of Health decides what are professions that we are really focused on across all of British Columbia. And you can see there are several here that have been identified. There are some other priority professions, but they don't fit into positions that we have at Northern Health, like perfusionists, for example. So these are really focused on our external recruitment and don't get into the physician side of the house as well. So you can see at the very top there, all of our nursing professions are there, as well as when you're looking at community health workers, and then our OT and PT, sonographer, pharmacy tech, social worker, MRI, med lab technician. And another thing to be aware of is that even though these are priority professions that often then get elevated in the focus that we have, Northern Health also has identified some professions that we're just saying they're professions of focus because they are for Northern Health, and that is pharmacy technicians and provincial public health inspectors. And what happens when we have a priority profession, or the profession of focus that we identified as the two of them there, is we do an incomplete plan around each of those professions. We update them yearly as well. So we're really watching closely the trends. We're working really closely with our post-secondary partners and the ministry connected to those professions. The next slide I'm going to turn over to Angela, because this is Fort Nelson Review, and this was as of today. So we're really fortunate at Northern Health. We have an incredible department that looks after analytics, and they were able to update where Fort Nelson is as of today. So I'll turn that one over to you, Angela.
Thanks, Sandra. And so these slides are very small to read, and we'll make sure that you get a presentation package. I tried to send it to Jaylene and Scott a couple times, but it kept bouncing back. So I'm not sure if you did, in fact, get them. So, but we will make sure that you do get them. So this shows on the left-hand side how many active employees we have for Fort Nelson. So there's currently 80 with 32 of them being full-time, with 12 of them being part-time, and then another 36 that are casuals. So that ranges from nursing to support services like housekeeping, laundry, food services, maintenance, and then we have a number of medical lab assistants that are also casual within that. And so it breaks it down in terms of what is our percentage for regular casual staff, as well as the average age is 45 to 48. And the average length of service is 6.7 years. Now, this is quite a bit higher than what we see both within the rest of the Northeast, as well as Northern Health, which is right around, in all of Northern Health is around 3 to 4 years, with the rest of Northeast sitting right around anywhere from 2 years to 3 years. So this is a good sign in terms of that Fort Nelson, once they come to Fort Nelson, they're keeping them for a longer period of time. And then the bottom graph just shows by the 5-year increments in age, kind of how many are full-time as compared to part-time and casual, and the colors correspond to the large circle up in your left-hand corner. The graph on your right-hand side, as you can see, there, we have actually got 6 employees that are above baseline. So what that means is that they're unfunded positions that we've either increased because they were part-time and we've increased them to full-time and just kind of risk managing the funding, or like our home support. So previously, we had funding for 1 full-time home support worker. We identified that that is not meeting the needs of the community of Fort Nelson. And so Annette has worked over the last year with her staff and physicians and community in terms of what type of in-service or increase in services are required to keep people at home where they want to be. And so now we are providing an extended service 7 days a week instead of 5 days a week. And instead of an 8 to 4, the hours are extended into the evening to help with settling, to help with some respite, prevent caregiver burnout, those types of things. So that just this shows more in terms of the length of service that we have on this slide as well. When we go into our most pressing need at this time is, as you're fully aware, is the Fort Nelson lab. And so right now, as you're aware, we've had some staff loss in the last 12 months. We had one MLT move to Smithers and one medical lab technician, the chief tech, left Northern Health for a position down in the Lower Mainland. We have had 2 external hires. So we have hired a permanent full-time lab assistant, and we've also hired a full-time lab clerk. So talking about the lab clerk, that's added some supports in terms of providing regular scheduling of patients that used to be done by the front desk, as well as receiving and registering patients. And so now the clerk will book the appointments for the patients, as well as do other functions such as ordering, restocking supplies, so that the lab assistant can totally dedicate their time to the lab services. We've also created a second permanent full-time lab assistant position, and that position will be filled starting August 29th. And then, as Sandra had mentioned, the medical lab technicians are deemed difficult to fill. So difficult to fill is they exceed 90 days of external posting outside of the organization. And we fortunately do have an agency coverage that has been able to allow us to resume some of the services that we previously had to suspend. And now we have some after-hour services as well for emergent and urgent at the hospital. And none of the departures that had left were within 3 years of service. So both of the MLTs had worked in Fort Nelson for greater than 3 years. The current lab postings, so we have the full-time lab chief lab tech, as well as the full-time lab technologist. As I mentioned, just the high vacancy rate with the MLTs, the turnover with new staff, 100% of the workforce within the last 3 years, and then recruitment challenges with the average time to fill external positions, 103 days. We are offering $10,000 signing bonus for a 2-year return of service. We're sourcing candidates via the provincial professional registries across Canada. We're sponsoring social media postings through Facebook, Instagram, LinkedIn. We're paying for advertising on the professional media publications, as well as e-blasts and job postings in a various number of sites. I'll turn it back to you, Sandra.
Oh, thank you. So there also are some provincial initiatives that are taking place. Right now, the Ministry of Health has set a table that's called the Provincial Health Human Resources Committee. Both our Vice President of Human Resources at Northern Health and one other resource sits on that provincial table. And then that table has several subcommittees. So the first 2 subcommittees that were struck that I sit on, both of those are provincial incentives and internationally educated nurses. So the Provincial Incentives Committee, what we were tasked to do is really look at all of the incentives that health authorities are looking at, are using currently across British Columbia, because we wanted to make sure that we weren't competing against each other for specific professions and for incentives. And so when we're looking at what professions should be getting incentives, what is the baseline vacancy, for example, how can we ensure they're net new to the province, except under very specialized circumstances, those are the types of conversations we've been having. It will be the PERC, and that's what it's referred to as an acronym, committee will be making all the final details about incentives in British Columbia. So Northern Health has been asked, along with all other health authorities, unless absolutely necessary, not to move forward with any new initiatives until this committee has completed its work. It's in the final stages. The subcommittees that I'm speaking of that PERC will set up are really meant to be set up, work for 3 to 6 months, and then disband, right? Get the work done and then move very quickly through that. So the subcommittee work will be going to PERC in the next 2 or 3 weeks. And so we'll then have a framework around what is happening provincially and really talking about how we can bring in net new healthcare resources to the province of British Columbia. And so that's some of our key areas there. And then, of course, incentives will be set according to several criteria. And of course, when we're looking at rural remote, that's one of those criteria that really, I think, will be able to, I would say, have some good benefits of how the structure of these incentives will be set out, just because our numbers when we're looking at evidence-based decision-making and stats are quite out of sync with our more, I would say, urban centers across the province. And so we'll see what that work, the final details are on that. The other work that is super exciting, and not that the incentives aren't, but I found really exciting, is the internationally educated nurses. That is a committee that's looking at how we can be fast tracking or at least reducing barriers and moving internationally educated nurses through the process really quickly. Right now, Health Match BC, along with a lot of 2 or 3 other regulatory bodies, help with supporting internationally educated nurses come into Canada, but it usually will take 2 to 3 years. So there's a very long delay time in getting all of those services completed, all the paperwork completed. And in addition to that, it can be very costly, which can be a barrier to many of our internationally educated nurses. And so this group is looking at trying to remove those barriers. There will be bursaries that are available to help support, bursaries up to $10,000 for additional education folks might need to take RN. In addition to that, we're very fortunate in the Northeast that we are piloting, sort of giving, I would say, additional supports with one group of internationally educated nurses. So we're really trying within Northern Health to move this process forward as soon as possible. And some of the work is already in place, but unfortunately, as a result of that, we did lose one of our recruiters to Health Match BC, who is going to be working on the team that is doing the navigation with students and with internationally educated nurses. But we think that that will pay off very well for us in the sense that she is very familiar with Northern Health, has worked with us for 7 years, and understands the reality of our rural remote perspective. So although it was a loss to us and our team, we're hoping that we'll have some dividends at the end of that as well.
Yeah, and Annette has identified 2 in Fort Nelson that are internationally educated nurses who are working in other positions. And so
I think we lost you. We froze our screen. Okay.
And is what I'll do. Where did we leave off? I'm assuming nothing went further from those provincial incentives.
No, I think you were speaking about the provincial incentives and the nurses that are the foreign nurses.
Right, the internationally educated nurses. Yeah, so that is the provincial work that is taking place right now. As I said, we really are excited about what we think will happen when we're able to better support internationally educated nurses with the costs associated with attending different education courses and also all the assessments. So there's 2 different assessments that they need to get through, including travel, particularly for the north, and the travel for those assessments are also going to be covered. So looking forward to that. And as I said, although we lost a recruiter, we believe because she's now in this provincial program, she'll be able to support us. The other initiatives, and now you won't be able to see this slide, but we will get all of these decks to you. Some new initiatives that Northern Health has is we have a First Nations Health Authority and Northern Health joint talent sourcing specialist. And so that's a position that really focuses with both Northern Health but our Indigenous partners. And we were really fortunate to have Coco Miller joined us from the Northwest. Has really done a great job of getting that program up and running. Unfortunately, she did resign from that position about 2 weeks ago. The good news is she's coming over full-time to Northern Health and is going to be working with Indigenous Health. So as we move to fill that position, we'll be able to keep the momentum going because she will still be with our organization. So we're very excited about that. We also were able this year to get a Northern Health Communications Specialist that's dedicated to recruitment. And this person, Robbie Poser, is from our communications team. And he develops and implements all of our digital recruitment and marketing strategies. So we felt we weren't as far out there as we could be on Instagram and Facebook and all the other different platforms that particularly younger people are using. So Robbie is developing that for us. At the end of this presentation, when you receive it, you'll be able to see how you can follow us on our Instagram and our Facebook accounts, because what's really important when we're doing advertising and we're focusing on a community or a profession, for example, is to have that amplified. And so it's great when we can have people join those groups, and then when you see a job advertised, you can just like it, comment on it, and then it goes out to your entire network. And so we can get some really good range. And when there's people in your community that hear about positions and they've got a niece or a nephew or an aunt or a family member or a friend that lives in the community, we know that that is a draw to help us recruit. So that sort of fits into everyone's a recruiter, including everyone in the community. So both of those links are at the end of the presentation that you would be able to share with others. We've also enhanced our external job posting, so we're incorporating greater details about the position, work location, and the community. And so that has been positive for us. We've updated I think there's about 1,200 postings that we updated with those details, as well as implementing a candidate relationship management solution, and that really helps our recruiters deal with individual candidates over a long period of time, and also collect all kinds of information from folks in particular professions, so that when we talk about an e-blast is just an electronic blast that would go out, let's say, to every physiotherapist that we've come into contact with, because it might be that we've met them at schools or we might have met them at career events, but we don't know what their current work situation is. So we can just get out to them, all of them, all at the same time when there is an opportunity at Northern Health, because often it's those windows of opportunity to get people into the health authority. Other new initiatives that we have is we've expanded our difficult to fill professions, and I told you a few of those that we had already moved to, but other ones that we're looking at is lab assistants. We've got critical care nursing incentives, diagnostic imaging incentives, as well as pharmacy technicians. And we're also in several communities have implemented the Ministry of Health prototype for the rural and remote incentive. And I do believe that Fort Nelson is part of that as well. We also are looking at working with our post-secondary institutions for healthcare programs and seat expansions. Where we've been most successful with the seat expansions is with our healthcare access program, and that has been really positive for us. We have seen more healthcare assistants graduated. And for those not familiar with that program, it's a program for community health workers and healthcare assistants where they are put into a healthcare program. Their tuition is paid, their books is paid, and they also are given a stipend while they're going to school and while they are doing any clinical. So they truly can get their education and maintain, paying rent and not going into debt until they come out and will have a 2-year return of service. Now, is there any questions on that before I talk about some of our community partnerships?
Sure. Councillor Goering, go ahead.
Well, thank you. What was the name of the last program you were talking about that pays for the education and a stipend?
Oh,
what was the name of that?
Okay, that's called, that was called the Healthcare Access Program. We refer to it as HCAP.
And are the details
so
like, sorry, the criteria?
The criteria and details for that are on our webpage, but if you would like, I can make sure that I also provide the details on the Provincial website. Is called Choose to Care. That's the healthcare access program is on there, and it has all the details connected to that as well as on our own website as well.
Okay, thank you.
The nice thing about that program is the qualifications are grade 10 or above. And so if people have been unsuccessful getting into other healthcare programs or didn't complete other healthcare programs or graduate, this is a way for them to actually get their schooling paid for, make money while they work. And so we use really nice taglines like earn while you learn, and have had some fabulous success. And our first graduating classes have started graduating and working for us in 2022.
And Angela here, can you hear me?
Yes, go ahead.
Sorry about the connection. So, Councillor Gerwing, I'm not sure if Annette was able to get back on, but there is one candidate in Fort Nelson, and I think they're going through either in the summer or the fall and joining one of the programs. And so we are encouraging individuals who are interested in Fort Nelson to consider applying for this program as well.
Yeah, thanks, Angela. Sounds like a great program. So I'm grateful to hear about it now, and we'll definitely look up the details and help to spread the word for sure.
Thank you. So can you just outline where we're sitting here as far as employment or vacancies in our hospital and how that compares to the rest of Northern Health? Angela?
Yeah, I'm just wondering, Annette, she would have the best information. Annette, were you able to make it on? Okay, it doesn't sound like it. So most of our positions in terms of support services, facilities management, front desk registration, health records are all filled. Community positions are all filled as well. So all 4 nursing positions that are RN and there's LPN positions are filled. We are short a couple home support workers at this time. Our social worker has just left community, so there is a vacancy there for the social worker. I think she left in beginning of June or right around that time. So now we're posting and advertising for that. And is that you, Annette?
Yeah, can you hear me?
Yes, we can.
Hello? Oh, fantastic. Sorry about that. I'm not sure the technical issues. I did hear Angela mention about our HCAP students. We actually have 3 HCAP students who are actually graduating in November 7th. 2 will go to community and 1 will come to the hospital. Angela is correct. All our nursing lines are full at the health unit. Our social worker has left to go to Dawson Creek, family move. So that position is posted. The lab tech positions are posted. All nursing lines are filled except for one LPN line. We have one student nurse who is coming back to us mid-July. She's just finishing up her practicum, and then she has to wait for her licensing to come through, and then she will be coming back to us. And then that leaves us with one LPN line open.
Thank you. Ms. Wager, we've got an assistant lab tech, we've got a lab clerk now, and we've got an assistant lab tech. What other lab positions are there that we need to fill?
So we have the chief lab tech, and we have two lab tech, one lab tech position, and then one lab tech position is on leave, but potentially coming back to us. I will know more about that in the next couple of months. We have two lab assistants. One is working now, and the other starts as in Angela's presentation, August 31st. She is coming to us from Ontario. She used to be a medical lab technologist in the Philippines, and she looks like she's going to do her education, potentially do her education to take the MLT. And we have a lab clerk. We also have two casual lab assistants who are taking their medical lab technologists. One graduates in 2023 and the other graduates in 2024.
So when you look at the vacancies within our hospital and compare it across Northern Health, are we doing worse, the same, or better than most facilities?
Well, that's a great question. I can honestly tell you that we're doing way better than when I first came here, because we had multiple open lines, and we worked really hard to try to fill those. So I think we're comparable. Maybe doing a little bit better because we are a smaller site, right? We don't have like numerous of lines to fill. But that might be a question for Angela or Sandra to know how we are doing across with everybody else.
Yeah, when we look at it from a nursing perspective, in most of the Northeast communities, we're sitting at between a 30 to 40% nursing vacancy. So Fort Nelson is by far doing a lot better in terms of having all of their positions, with the exception of one in hospital, and all of their community positions filled. That's not the case in any of our other Northeast communities. The key area is the lab right now. That is where we're struggling in Fort Nelson. But we've got, the backup plans with the point of care testing that nursing are supporting, along with the agency lab tech, as well as the lab assistants.
Okay, thank you. Councillor Gerwing.
Yeah, could I just have some verification on the social worker position? So if I'm remembering correctly, this social worker position used to be full-time, and then it was reduced because the candidate who was coming back from a mat leave didn't want it to be full-time. So has it been reposted as a full-time position or a part-time position?
I can answer that, Lorraine. It has been posted as a full-time position. And you are correct. When the previous social worker came back, due to having little kids, she wasn't able to work full-time. So we accommodated that schedule, and now it is posted full-time.
Great. Thank you so much, Annette.
Is there any other questions? I'm seeing no other questions around the table. So if there's anything else you'd like to conclude with, Mr. Smith, go ahead.
Yeah, I would just like to thank you for the time, and, feel free to invite us back for quarterly reports. We appreciate the involvement both at the community health planning meeting to talk about services, as well as where we're at with our workforce, as well as the innovative work that the municipality is doing in terms of their thoughts around recruitment and retention. So, we continue. This is one of our key communities within the Northeast because of the distance factor. in terms of continuing to work to make sure that we have sufficient staff to maintain our services up there. So thank you, and I don't think I have anything more to add.
Ms. Rossi, Ms. Wager, anything else to add before you go?
Nothing more to add. Just thank you very much for your time. And just, Angela, when you send the presentation, I think if we take out the pictures, it should go through fine. I've had trouble with some of our files are really large when we have pictures in them.
This is Annette. I appreciate the time, and my office door is always open. So if you have questions or you just want to come down for a conversation, you're more than welcome to come. But I appreciate the time.
Thank you very much. Thanks all of you for coming and making that presentation to council.
Thank you.
Thank you.
Okay, I'll ask for a motion that we move to a closed meeting pursuant to section 91C and I of the Community Charter. Can I have that motion, please? Moved by Councillor Penny, seconded by Councillor Andrews. All those in favor? Carried. And we are in a closed meeting. I'll recall the Special Regional Council meeting, and I will declare the Special Regional Council meeting adjourned.